Hello, in this video, I'm going to talk about muscle damage and delayed onset muscle soreness in strength training. Strength training causes disruption of tissue. There's no way around that. The high forces that are exerted on the tissues damage them. So there's damage to proteins and all sorts of things inside of the muscle cell. This is especially evident during eccentric contractions, in which less muscle area is activated to generate force compared to concentric contractions. So essentially what we're saying there is that more of the muscle is activated during a concentric contraction to produce the same amount of force as during an eccentric contraction. So less tissue is working to produce the same amount of force, which means that there's more force being exerted on that smaller amount of tissue during eccentric contractions than concentric. So there is significantly more tissue disruption during eccentric contractions. So here I listed some of the specific tissue disruptions that are taking place in the muscle cell. I'm not going to go into detail on any of these, but it includes cytoskeletal disruptions, Z-disc streaming, A-band disorganization, membrane damage, sarcoplasmic reticulum damage, hypercontracted regions, localized areas of increased intracellular calcium, increased incidence of desmin negative fibers, and loss of dystrophin organization. Those are some of the effects that have been seen in the literature in terms of what is damaged or disrupted in response to eccentric training. So damage following eccentric contraction. So it is evident that the damage, all the things I just listed, are worse usually several days or even a week after the strength training session compared to immediately after. So that is evidence that what is happening, this disruption in the tissue, is actually part of the repair process. It's part of adaptive remodeling of the muscle tissue rather than like mechanical damage that is happening during the exercise. If that were the case, then that damage would be evident immediately following the training session. And so the fact that it really isn't present or apparent until maybe a week later, sometimes a little sooner, but not immediately following, that means that the body's doing that on purpose to help repair and remodel the tissue. So the damage is more severe in type 2 fibers. Muscle force capacity is reduced following damage to eccentric, or following muscle tissue damage because of eccentric contraction. It reduces muscle force capacity. And it can be lower for days and even up to several weeks, depending on the severity of the damage that occurred and how well the body is recovering. So inflammatory response is induced by damage from the eccentric contraction. So we tend to demonize inflammation in our society. We want to get rid of inflammation because it hurts. It doesn't feel good. But in reality, inflammation is an important part of our immune response, and it's an important part of our body's ability to heal and repair tissue that's been damaged. So we don't want inflammation that is going on longer than it should. So after the problem is already solved, and we don't want inflammation when there was no damage and there is no problem to solve. So inappropriate inflammation that's caused by diet or other things, that's not good. And we don't want that. But inflammation is a normal part of our body's response to tissue damage, and it helps us repair that damage quickly. So when we have this tissue damage in our muscle fibers in response to eccentric training, there's an inflammatory response that happens in the muscle, and that's why the muscle tends to swell a little bit following training. It's a common phenomenon that many of us are aware of. So we'll have slightly swollen muscles. And that's because we've induced inflammation in that muscle. And that inflammation, that inflammatory response, is also a big part of why the muscles get sore and why those muscles hurt during and following exercise. Let's keep going here. So delayed onset muscle soreness, that's DOMS. That is a common phenomenon that is muscle soreness, and it can be very extreme. that is caused by eccentric contraction. So it can be caused by all sorts of activities. So it can be in strength training, hiking, all kinds of things, but it is specifically caused by the eccentric contractions that are part of whatever the activity was that you were engaging in. So like, for example, if you were going to hike up a mountain, going up would be the concentric contractions and going down would be eccentric. So as you're going down the mountain, your muscles are lengthening and contracting as they're lengthening to control your descent down the mountain. So if you're sore the next day, you're sore from going down, not from going up. Generally speaking, in that scenario, going up is more challenging cardiovascularly and going down is more challenging muscularly. So which one is harder depends on where your strengths lie. So in DOMS, the muscle soreness usually develops within 12 to 24 hours after the exercise session and peaks. It becomes the worst between 24 and 72 hours following the exercise session. The exact mechanisms that cause it are not known, but it seems to be more closely related to tears in the extracellular matrix and then the inflammatory response because of those tears, rather than disruptions in the proteins and that whole list of things that I showed on that first slide. So it seems most likely to be the result of tears in the extracellular matrix and the inflammatory response afterward. Sometimes people take NSAIDs, non-steroidal anti-inflammatory drugs like Advil and those sorts of things to reduce inflammation and thus reduce pain. But it's been shown that when we reduce the inflammation in the muscles that are part of DOMS or following the eccentric training, that it actually compromises the muscle function and the ability of the muscle to recover. So even a month later, you'll have decreased function if you've been taking NSAIDs. NSAIDs interfere with the muscle's ability to fully recover, and the inflammatory process seems to be very important in the recovery and repair of the damage in the muscle tissue. So although it's painful, it doesn't feel good, suppressing that inflammation works against us. It works against our ability to repair and recover and have the adaptations that we're seeking. It interferes with that process. And so it was all for nothing, ultimately, if we're chronically taking NSAIDs to deal with the inflammation. Now, with that said, DOMS is not necessary to achieve gains in strength or in hypertrophy. So although it's okay to be sore, it's okay to have sore muscles when you're working out, we don't have to have sore muscles to achieve gains in response to our exercise. So we don't want to suppress the pain if we have it, but we don't have to induce it in the first place to achieve strength and hypertrophy gains. So if we want to avoid excessive soreness to the point where we feel like we need to take NSAIDs to reduce the inflammation and the pain, if we want to avoid that in the first place, then that's where we just need to be careful about our progression. How fast are we progressing? How much weight are we using and how quickly? So just if you gradually increase over time instead of doing too much too fast, then we can avoid DOMS entirely, and we don't have to be especially sore. So aim for maybe a little bit of soreness. That's okay. It's a sign that you've done something challenging and you've stimulated adaptation. That's okay. But it is not necessary and it does not need to be in the extreme. And in the real extreme, we can start to have breakdown of our muscle fibers, and it can overload the kidneys and cause serious kidney injury. And it can cause serious breakdown of muscle tissue that could, if it goes unchecked, result in amputation and all sorts of serious things. So if you are very sore and you had a really hard workout within the last couple of days, and keep an eye on the color of your urine. If it gets very dark, that's a bad sign. If you have extreme pain in any certain muscles in the body, bad sign. Go to the hospital just in case. All right. Thank you so much for watching, and I'll see you in the next video.